Okay, well, hi everyone. My name is Shantice Mantilla with Baptist Health South Florida. And as a healthcare organization that cares, Baptist Health is committed to providing virtual community health classes to help you stay well while you are hopefully safe at home. For more information, please visit events.baptisthealth.net and search virtual. For those of you who have joined us before, welcome back. And for those of you here for the first time, welcome. As a reminder, this is a webinar style, so we will not be able to hear or see you, but you can leave your comments and questions in the chat or Q&A, and I will be here to support you on the back end. So with that, today's focus is head versus heart attack, and we have two wonderful speakers to discuss this topic. I'd like to welcome Dr. Johnson. Good morning, Dr. Johnson. How are you?
Good morning.
How are you? Wonderful. So Dr. Johnson, please tell us a little bit about yourself.
Hello, everyone. I'm Dr. Heather Johnson. I am a preventive cardiologist here at the Christine E. Lynn Women's Health and Wellness Institute of Boca Raton Regional Hospital and Baptist Health South Florida. For over a decade, I have had the pleasure of working with patients and their families, helping people achieve a heart-healthy quality of life. However, what brought us together is that over the past 4 months, our lives have been changed due to the global pandemic known as COVID-19. And it's impacted each of us individually and in our community. And so it's been a pleasure working together as far as with everyone to help address some of the questions that were coming as far as symptoms people were experiencing during these stressful times. And so some of the most common questions I received were, how do I know if some of these symptoms are due to my heart or due to the stress that's going on in the world? How do I know if the symptoms are just all in my head? And so together with Shantice and collaboration, I had the honor to work with Barb Schmidt to be able to help us explain that connection of the heart and mind. So to introduce you, Barb is the co-founder of Peaceful Mind, Peaceful Life. In 2011, Barb Schmidt and Michelle Merrows founded Peaceful Mind, Peaceful Life to bring mindfulness teachings to the community and make them accessible to everyone. They have impacted lives around the world with more than 8 million social media followers. A little over 4 years ago, Boca Raton Regional Hospital became a partner of Peaceful Mind, Peaceful Life to present what is well known as the Wellness Series. Established here at the Lynn Women's Institute and now more far-reaching, Barb and Michelle have introduced the community to mindfulness and meditation, recognizing the power of an East meets West approach. Barb Schmidt is a businesswoman, philanthropist, meditation and mindfulness teacher who has devoted more than 30 years to spiritual development and research. Barb is the author of the internationally best-selling book, The Practice: Simple Tools for Managing Stress, Finding Inner Peace, and Uncovering Happiness. She regularly lectures at schools and organizations across the country to spread her message of living a meaningful, happy life. Rooted in the belief that outer peace brings inner peace, Barb is dedicated to furthering their mission through education, inspiring individuals, and creating community. And at this time, I'm thrilled to welcome Barb to today's conversation. Hello.
Hi, Dr. Johnson. Oh my gosh, I'm so honored to be here with you. Oh, it's so amazing. What a joy.
My pleasure.
Yeah, so incredible. And I'm so happy to be with everyone that's on this webinar. So welcome, everyone. Today, I would like to share with you some simple tools, sometimes not all that easy to remember to practice, but really simple tools that you can use to manage stress and anxiety. I know that this year has not been going as any of us had planned, and big changes can bring a lot of stress. Many people have said to me and are reporting that chronic stress during this pandemic is at an all-time high. Trouble sleeping, decreased productivity, and increased fighting are just some of the issues that truly can be related to the stress that we're all feeling. Stress can impact our thoughts, our behavior, and overall well-being. So my goal today is that you will walk away with one nugget that will help you make navigating stress more manageable for you in your daily lives. So thank you all for being here today. Dr. Johnson.
Thank you, thank you. You know, some of the things that we were discussing was as far as that mind-body connection and how our body is really responding to some of the symptoms. And during our discussion, we've shared some similarities, but noticed some key differences as far as how the heart may respond, but then also how the mind may respond as far as the stressful moments. And It's been a pleasure as far as our team coming together and developing this figure that really starts the conversation here. Shantice, would you mind bringing up the figure, and Barb, I'll let you take the lead.
Okay. So some people confuse having a panic attack with having a heart attack, because a panic attack is a real intense physical reaction, and you may feel like you're dying or out of control of your body. So panic attacks come on suddenly, seemingly out of the blue, out of nowhere, and can be really frightening. So I want to introduce into this conversation right now the importance and the benefit of connecting with, knowing, understanding, and trusting your body completely. It is my belief that mindfulness practices truly help us facilitate this mind-body connection, which actually leads us to a deeper knowing of the body. So in this knowing, we can begin to differentiate between having a panic head attack or a heart attack. So let me walk you through a little bit of these symptoms here on the left-hand side here under panic attack, head attack. So some symptoms, as I said, of a panic attack can be an increased heart rate or a pounding heart or shortness of breath or tightness in the throat. If you're having a panic attack, you may also experience sudden sweating, dizziness, nausea, hot flashes, or even chills. So many people also report tingling or numbness in the hands, and some people shake or even have pain that accompanies the anxiety. But the stabbing chest pain is short and only lasts about 5 to 10 seconds. The pain is usually localized in one small area and usually occurs when you are resting. And the symptoms usually peak in less than 10 minutes, but sometimes may last even longer. So Dr. Johnson.
Yes, no, that is extremely, extremely helpful. And it was, we talked a lot as far as these differences. And from the heart side, I've had a lot of patients say, how do I know if some of these symptoms may be from the heart, either a heart attack or just decrease as far as in blood flow or some other concerns? And one of the key differences has to do with some of those chest discomfort symptoms. In contrast to some of the stabbing chest discomfort or sharper discomfort, what we tend to notice on the heart side regarding heart attack or a medical heart issue is more of a squeezing discomfort, a pressure. And we also notice that with that or by itself, the heart rate, although it may increase, can usually be irregular. Some people notice that with discomfort that there may be a spread, or also known as a radiation, to other parts of the body, such as the arm, the jaw, neck, back, or shoulder blades. But it's also important to know that sometimes those may be the only discomfort areas. It may not be the chest. You may present with more arm, jaw pain, or neck pain. The other thing is that in contrast to being at rest, these symptoms from the heart may awaken you from sleep. You may have more of a cold, sort of a clamminess, as far as a cold sweat. I'll come back to fatigue in just a bit, but usually these symptoms are worsened by exerting ourselves or doing activities, such as climbing the stairs, and if you slow down or stop, the symptoms are relieved. The other thing is that the symptoms may become worse or just continue to return regardless of what else is going on. So every time you get ready to climb the stairs or swim your usual laps or walk around the block, etc., you notice that it continues to come on and you're decreasing your activity. For women, though, I just want to highlight is that we may present very differently. That's going back to that new or unusual fatigue. You may present with stomach discomfort, indigestion, more dizziness or lightheadedness, and it may not be the usual chest discomfort. So as a preventive cardiologist, I really try and highlight that it's important for us to understand that yes, heart attack is the #1 cause of death for both men and women. However, how we present can really vary. And understanding what are some contributors or what we call risk factors to that heart attack side of things, what may be contributing to us having a heart event, it's really important to know that history. And that's where we talk about diabetes, high cholesterol, some chronic conditions such as lupus or chronic kidney disease. But also for women, and we've been having this discussion more and more, is that as women, we have some other risk factors that differ, such as pregnancy-related risk factors, pregnancy-related high blood pressure, pregnancy-related diabetes. And then also we're learning that on our mammograms, that can be a hint if there's increased calcium in the arteries of our mammogram. So we're learning a lot as far as not just how our head and our heart symptoms may differ, but then also what may happen as far as men versus women presenting very differently too. And you know, Barb, there's been a lot of discussion that as our daily lives have changed, unfortunately with COVID-19, and for some it's been slowing down or differing, on the mind side, I'm hearing a lot that things are speeding up quite a bit. Can you share a little bit more? And Shantice, thank you for the figure.
Yeah, definitely. I think it's interesting how the outside world, especially in the beginning of this pandemic several months ago, totally shut down. And so the distractions disappeared. So it caused our inner world to speed up. And I think all of us have been feeling that. And now that we're starting to open up a little bit, we can start to sense that we've got to shift even a little bit more. And so I want to emphasize, I love how you've contrasted the two, a head or panic attack with a heart attack, because I want to make sure that we all understand that panic is usually a sudden, intense experience. And as we said earlier, it's important to remember that during a panic attack, your physical symptoms feel severe and you may feel like you're dying or losing control. So it's easy to confuse that with, oh my gosh, maybe I'm having a heart attack. And sometimes people have panic attacks, like I said, just out of the blue. It just hits you like that. And I think that's the interesting thing about a panic attack. It really can hit you suddenly. Where anxiety, on the other hand, because I hear so much from our social media crowd, where anxiety, on the other hand, can be mild, moderate, or severe. So you may not even recognize when you are experiencing a mild anxiety. It can come out sideways, like difficulty falling asleep or feeling moody or irritable. So both panic and anxiety involve the emotion of fear. So anxiety is defined as excessive or persistent worrying about everyday situations, which, let's face it, probably all of us feel that we've landed in that category at some point or another during this time. So the first thing I want you to remember is that feeling stressed right now is normal. So many people I talk to think that something is wrong with them because they are feeling stressed or they're not handling it. And social media can bring out that need to do it like everyone else is doing it. So you are completely normal. In fact, whatever emotions you are feeling, fear, anger, grief, numbness, frustration, they are all part of the human experience, the human condition, because we are human beings. And so what adds to this stress that we're feeling is when we start to judge ourselves for the emotions or ignore them or mishandle them. So if you are experiencing any anxiety right now, you're not alone. As we mentioned earlier, many of our day-to-day activities have definitely slowed down, and so our thoughts have sped up. So we are overthinking, we are worrying, and we are ruminating more than usual. And I believe, why is that? Because with the 24/7 news stations and reminders of the real world possible dangers, we can feel like we're living in survival mode more often than ever before. So instead of focusing on the present moment, we are letting our mind wander and start worrying about what the future is going to be like. So I want to share with you some, just this ability of understanding that the present moment is where you really want to be, even if it feels like it's not where you want to be. And I'll share with you some tips about that later. So Dr. Johnson.
No, I appreciate it. And I do agree it's important as we focus on that East meets West approach, as far as also providing some heart healthy tips, and I'll let you share yours in just a bit. And I want to highlight something again that you've said, and it's one of the first tips that I've been giving everyone, is really listen to your body. Don't ignore the symptoms. It's our body letting us know that it's trying to deal with everything that's going on, either now during the pandemic or other stressors that are in our lives. And so I always say, number one, listen to your body and be your own advocate. I've had people ask me or try and describe symptoms, and they said, well, I don't think it makes sense because I can't describe it correctly. I'm saying you're describing it how your body is causing you to feel. That's how you are feeling right now. And so the description is perfect. It's reflecting what you're feeling. Listen to it and let's talk about it. The second thing is that no matter how hard it is, let's try and keep moving. It's very, very difficult for us to go about as far as what we considered our normal activities. But even when stress takes a hold, just keeping moving just helps to relax those blood vessels and helps to also protect our heart and help our heart manage that stress. The third thing though is also, if you do smoke, try to focus on cutting down. It may sound very, very difficult during these stressful moments, but you'll notice just by cutting down on the cigarettes, how the heart and the body begins to respond to stress can definitely improve. We're also highlighting and asking people to check your blood pressure. Interestingly, it's one of those silent things that happen as far as when the body is constantly trying to manage stress. We may notice that the blood pressure may increase over time. Instead of going down like it should, it may begin to increase. And so high blood pressure can be a significant risk factor or a major cause of heart attack, stroke, and heart failure. And so keeping an eye on it can be very helpful as to how your body or your heart is responding to stress. And then lastly, we're encouraging everybody that if you have severe symptoms, don't wait. Please go to the emergency room. Don't try and avoid the emergency room because of COVID or other issues. Protecting that heart, protecting your brain is extremely important. And it's very, very important that we continue to focus on our heart health even during the most stressful times. Barb?
So now let me share with you some tools for managing stress. I think often we feel like we're at the mercy of it and that we just have to endure it and push through it, and we don't. So some of the tools I want to share with you today are simple and easy, and it's just remembering to do them. So when stress has no clear endpoint, and I feel like that's what's happening for many and most of us today, it is more challenging to cope with it. So give yourself a break. Let yourself off the hook. This is all normal. I cannot say that enough. It's normal. And so we want to listen to the body. Really important to listen to the body right now. And I believe what's happening for all of us right now is a lot. And so please just remember that. We don't know when our lives going to return back to complete normal. We are kind of in the process of that. So many, many people out there are experiencing chronic stress from the uncertainty. We're not really good at not knowing. So it is important to find these coping techniques that will support you and that will help you in the stress that you might be feeling, especially if it's really starting to affect your daily life. So the first tip I want to share with you is a coping technique for acute stress, such as a panic attack. If you're feeling overwhelmed by fear, the tool is called the 5-4-3-2-1 coping technique. It can help you ground in the present moment. So the first, name 5 things that you can see. Look around you and name 5 things. The chair, the ceiling, the carpet, the door, the trash can. Then name 4 things that you can physically feel. Temperature of the air, inside soles of your shoes, the cushion on the chair, the roof of your mouth with your tongue. Now name 3 things that you can hear. Car outside, the door closing, a dog barking. Now name 2 things that you can smell. A cup of coffee or soap. And then name 1 thing that you can taste. Mint or maybe chocolate chip ice cream. So what this does is it interrupts the anxious thought patterns and it brings your attention to what you are experiencing in this present moment. And so simpler variations on this technique could be just naming the quietest or loudest sounds that you hear, or naming many objects such as their color, like red or blue, just focusing your attention that you can see wherever you're standing, bringing your mind into the present moment. Some people find it really helpful to use grounding stones. So this could be just a small stone that you carry in your pocket. And during times of panic or anxiety, you just focus fully on the feeling of the stone in the palm of your hand. Use this focus on the physical sensation of touching the stone to ground you in the present moment. Another thing, you could use a glass of water. Take a drink of a glass of water and focus on the physical movements involved in lifting the glass. See if you can notice the intention to lift the glass before you actually move it. Notice the physical sensations involved in drinking, like you are trying to describe to someone who has never had a drink of water before. So there are many variations that you can do focusing on one or more of your 5 senses. Everything is to help ground you in this present moment, to help you start to shift your focus away from the racing thoughts or the physical symptoms of anxiety and worry, and what is going to happen tomorrow. So it's so important. I just mentioned a few, but it's really important to find one that kind of touched you, that resonates with you, that you feel like that you can do. Another tip is deep breathing. So deep breathing, the breath is our life force. The breath is everything. We breathe without even thinking about breathing. So when you're consciously breathing, when you start taking some deep breaths, and this can be for severe panic or mild anxiety. So I want you to focus on taking deep breaths in, filling your lungs like you're filling up a balloon, and then make your exhalations just a little bit longer than your inhalations. So do this at a rate that feels comfortable for you, just one breath at a time, moment by moment. And so some people find it helpful when you're doing this to count your breath or to gather all of your attention on and your focus on breathing deeply by counting 1, 2, 3. And if you're experiencing chronic anxiety, you could even consider setting alarms or reminders on your phone throughout the day that it's time to pause and practice deep breathing for a minute or two. Remember, deep breathing activates the body's relaxation response. The moment you're able to connect with your body in the moment of anxiety and you start breathing, you're connecting the mind and the body together, and it signals it's time to relax. So when you're in the midst of an anxiety or a panic attack, it can really be helpful to acknowledge exactly what's happening. So pause, name what's happening for you in the moment. And the important thing is not to judge yourself for this. So trust that it will pass. Use one of these techniques. And it's okay if you need reminders from other people or this little reminder on your phone. Understand completely that no feeling is permanent, and just trust the beauty of everything changes in that beauty of impermanence. And so a last but not least powerful tool to help with chronic anxiety is repeating positive affirmations or mantras. So many of our negative thoughts contribute to the stress and anxiety that we're feeling. A negative thought cannot exist in the mind with a positive thought at the same time. So if you are feeling overwhelmed, one place to start retraining is by repeating a simple affirmation or a phrase to redirect your thoughts in the moment. So as an example, my daughter, Michelle, she recently was in a serious situation where she felt several panic attacks come on. She has a practice of using affirmations and mantras. So she immediately began repeating it in her mind to keep her mind from obsessing about the fear of what was going to happen next. Brought her back into the present moment. And she told me it was a lifesaver because it kept the focus on where she was in the moment instead of locking into that train of thoughts of racing, fearful, negative thoughts of what could happen next. So you could ask yourself, what encouraging words do you need to hear right now? And then stick that reminder somewhere where you look every single day, maybe on your bathroom mirror. It could be things as simple as "this too shall pass," or "be still and know," whatever set of phrases that will help you come back to the present moment, and just keep repeating those over and over to get you grounded in this present moment. This truly is a weapon against anxious thoughts and fearful emotions. It's a tool that helps you create the space for you to be able to sort out what your next right step would be. So if you're doing everything that you possibly can to manage stress and it's still impacting your daily life, I really want to encourage you to reach out. Reach out to trusted friends or reach out to a professional, a healthcare provider who you can help, who you can be honest with, and who they can help identify sources of stress and coping techniques that might really work for you. So to close, I would like to offer a body scan meditation to give ourselves a chance to connect with what we're experiencing right now in this moment. This technique can be used to reduce stress. So get comfortable in your chairs, however that feels for you. And begin by bringing your attention into your body. You may close your eyes if that's comfortable for you, or just lower your gaze to the floor. Feeling the weight of your body on the chair. Slowly bring your attention to the fact that you are breathing. Notice your whole body breathing without trying to control your breath in any way. Feel the air as it moves in and out of your body. Notice your belly expand on the inhale and contract on each exhale. Placing a hand on your abdomen, feel how your abdomen moves in and out with each breath. Feel your feet flat on the floor. Remember, we're just practicing being aware, and whatever you are noticing is perfectly fine. Become aware of the shins and calf muscles and the sensations in your lower legs. You can notice where your legs feel against the chair. Maybe feeling pressure, tightness, heaviness, or warmth. Bring your attention into your abdomen area. Is your belly tense or tight? Let it soften here. Feel your back against the chair. As you inhale, notice if you're having any thoughts or emotions that may be arising. Moving your attention now to your fingertips and any sensations in the tips of your fingers and your thumbs. Expanding your awareness to include the palms of your hands, the back of your hands, and your wrists. Allowing your hands to completely relax in your lap. Drawing your attention upwards, notice your arms and any sensations you may be feeling here. Where are your arms? How do they feel as they're touching your shirt? Now pay particular attention to your shoulders. Allow them to be heavy and lower away from your ears. This is an area where day-to-day tension is often felt by many of us. So shrug your shoulders up to your ears, pause there, and then let them go, releasing any tension. Notice how sensations and feelings change from moment to moment. Bring your attention to your neck and your throat. Soften your jaw. Allow your facial muscles to completely relax. Become aware of your lips and your cheeks. Move your attention upwards to your nose, feeling the air moving in and out of your nostrils. Does the air feel cooler going in and warmer going out? Notice any sensations you may be feeling around and in your eyes. Allow your eyelids and your brow to soften and relax. Now shifting your attention to your entire head. Notice the way your body knows just how to balance the head on the neck. Feel your whole body present. Experience your whole body breathing. What is it like to be you in this moment? Be aware of your whole body as best you can. Now taking 3 deep breaths at your own pace. In through the nose, exhaling out through the nose. Now taking another deep breath in. And on the exhale, name one thing that you are grateful for in your life. It could be that you're breathing in this moment. Taking a few minutes for a body scan meditation like this can recalibrate your mind-body connection. When we are going through stress, we can get so caught up in the mind, overthinking the past, regretting the past, or worrying and ruminating about the future. Mindfulness meditation brings us back to the present moment and what we are experiencing right now. So in the early 90s, I went on a week-long silent meditation retreat with meditation teacher and master Thich Nhat Hanh. The piece of advice that he gave, it has stuck with me for decades. Be where your feet are. During times of stress, chaos, or simply just confusion, come back to where your feet are in the moment. Use your breath. Mindfulness equals choice. So the only moment in time where you can choose is right now. So being where your feet are allows you to live fully in every single moment. Thank you so much for being here, and thank you, Dr. Johnson. So now I think we can open it up for some questions.
Thank you so much, Barb. I really appreciate it. Thank you. Shantice, any questions?
Yes, we have a few. So, Dr. Johnson, I know you mentioned some lifestyle practices that can help prevent heart attacks and cardiovascular disease. Are there some lifestyle practices that you and Barb recommend to help reduce stress and worry and potentially panic attacks?
I think Barb and I can both, answer as far as, so for me personally, as far as lifestyle practices, the importance of really staying active, even if, going for a walk can be extremely, extremely healing to the heart, lowering the blood pressure, allowing the body to relax, just some movement. Even if you're not able to go for a walk, chair exercises, chair yoga, something to allow the body to move, to promote the breath, and just allow the body to just release. It's not about weight loss. It's not about how many minutes at this moment. It's just about allowing the body to continue to move and to allow those relaxing chemicals in the blood vessels to be released. And it makes a very big difference on the heart and the body's health.
I love that. I think what I would add, my whole practice and my whole point of bringing East meets West together and bringing this whole program here today for all of you is it's easy for us to let the mind take over. The mind, we believe the mind, we trust the mind, we listen to the mind, we don't question the mind. And so I really want, if you want a lifestyle practice, it would be to connect the mind and the body together. Make sure if the mind is telling you something, feel it in your body as well. And then ask, is this true for me? So the greatest lifestyle change you could make is not just pushing through and allowing the mind to say, you're fine, it's okay, don't do this, oh, it's fine. Really asking yourself questions, pausing all day long. It's okay to pause, take a couple breaths, and then start again. And then pause, take a couple breaths, and then start again all day long. Connecting the mind and the body and really being sure that you're following what you want to be following and what the mind is telling you. Because so often we listen to the mind telling us things and they're not actually true. And then we keep going and we keep pushing. So, I mean, I think it's a simple lifestyle change. Just allow yourself to pause all day long to check in with yourself. But it's not always easy because we forget. So I guess if you start to feel any kind of stress or any kind of confusion, I like the word confusion. I've been using that a lot lately. Stress, anxiety, all of that is very common words that we use. But if you're just starting to feel a little bit confused, wait a minute, not sure what to do here. I'm not sure what's happening for me right here. Just stop. Take a couple deep breaths and start trusting yourself and trusting your body and knowing that you will know what the next right step is if you take the time to just stop and check in with yourself.
Wonderful.
I completely agree. Yes. There were a couple other things I thought about too. You know, our day-to-day lives have really shifted. And for both our mind, our body, even if our routine schedule may have shifted, the importance of regular sleep. Even understandably, our sleep may be a bit more disrupted, but at the same, as far as with our mind, and you know, we talked about the mind racing a little bit, but that healthy bedtime routine that's still trying to give the body the time that it needs to rest, to recover, and begin to just to be quiet and be able to process really what's going on. And lastly, I know, you know, especially when we talk about, you know, what's been open versus what's been closed, but also remember just the importance of, when possible, just healthy food choices. The body still needs its nutrients, it still needs the vitamins, it still needs to stay hydrated. And we're giving the body its strength as far as in rest and healthy food options, just to be able to continue to push through these and other stressful and uncertain times.
Beautiful.
Wonderful. Thank you so much. And Dr. Johnson, just to reiterate, I know you did mention if someone unfortunately finds themselves having the symptoms of a heart attack versus a panic attack themselves or loved ones, what steps should they take when they're presenting those symptoms? And if you can also share some of the best practices that are being taken by Boca Raton Regional Hospital to help treat these patients.
Great question. So a heart attack is a different level as far as the body's response. So if you're concerned about, you know, we talked about the chest discomfort, pain radiating, you've had fainting, if there's concern about a heart attack, call 911. That is important. Do not try, you know, even if you try and call your primary, they'll tell you, call 911. Let the emergency response team come to you, begin to evaluate and care for you. They can help begin to sort things out and make sure that you're safe. For general questions and concerns, and know that Boca Raton Regional Hospital at the emergency department, they are ready, they are available, they are responding to heart attacks, strokes, etc. In addition to also separately been caring for COVID-19 patients. And so they have everything separated. They know how to protect patients and also protect the staff. So please understand that we are available as far as in emergencies. For non-emergencies, there are also telehealth visits and in-person visits. And if you do come as far as in-person visits, there are a ton of safety measures that are being taken for patients and staff to ensure that everyone remains safe. And so never hesitate, please give us a call and know that we're available by telemedicine and in clinic as far as any concerns you may have as far as symptoms, and we're able to help and assist.
Wonderful, thank you. I'm sure our audience is very happy to hear that access and quality of care has not been affected in this unfortunate pandemic. So the next question is actually for Barb. So Barb, what are some ways to cope with anxiety related to uncertainty?
Very good question. Well, so first of all, the thing is, I know that if we thought we had control in the outer world before this pandemic, it certainly has shown us that we don't. And so I think it also has shown us that everything is always uncertain. We don't ever know from moment to moment what is going to happen. So I think the first tip for you is to really understand that this is the greatest truth. We never know from moment to moment. And I know that sounds scary and it feels like we can't possibly live like that, but we can actually thrive, because the not knowing opens us up to all the opportunities and the possibilities that will lie before us in the present moment. So it's important for you to understand that you are safe and protected in this present moment, not knowing what's going to happen tomorrow. And I say that very confidently. I don't mean safe and protected that you don't know what's going to happen in the outer world, but I know that being confident that you know that you have everything that you need to handle the next moment that presents itself to you. I think a lot of times our uncertainty and our unknowing comes from not trusting ourselves. We're not going to know what to do. We're not going to know how to handle it. Oh, this is going to be over my head. This is not going to work. All the doubts and all the fears that the mind is telling us. So I feel strongly that that mind-body connection and your ability to be able to check in with yourself and really little by little start to make yourself your most worthy travel companion on this life's path. You know, we forget that we are so important to our own life. We forget that we can trust ourselves. We forget that we have the ability to discern, what are we going to do in the next moment if something happens? And so my tip or my hope is that you start trusting yourself, knowing I'm going to be able to handle what happens next, because there really is no other way. And I think what I think this pandemic has really shown us is we have to have that belief in ourselves. We have to know that we don't know, and we never will know. And so being curious about it, even if it's difficult to accept the unknown and the uncertainty, or even if you're not an optimistic person, let's say, can you just get a little bit curious about, I can be open and receptive to the present moment. I can be curious about what the future could bring. We think the worst thing is going to happen, but good things happen as well. So could we just open up to a little curiosity? We cause our own anxiety and our own unhappiness by worry, and worry doesn't help. If it helped, we'd all be worrying and everything would be great. So I hope that helps, just to start trusting yourself and accepting yourself completely, and know that you have everything that you need to handle whatever comes your way. Recognizing you've done it before. You know, think back on all the times that you've been able to handle all of the things that have happened in life. You're really stronger and more powerful than you think.
Thank you, Barb. And I know you mentioned a couple of times throughout the discussion today that meditation and mindfulness are helpful. Can you help us understand what they are? What is meditation? What is mindfulness? What are the differences? And how can they potentially help relieve stress, worry, and anxiety?
Yes. So part of when this is what I love the Boca Raton Regional Hospital so much, because they're so open to helping get this East meets West, this mind-body connection. How can we actually use the incredible resources that we have in the medical community and bring together our own resources that we have within us? So all meditation truly is just being with yourself in the present moment. So there's such a misconception. It's not about stopping the mind from thinking. It's not about transforming your life and being able to do that in the moment. If you can stop the mind from thinking, then you'll have a whole different life. No, it's about truly being with yourself in the present moment with your breath. Let's say that's the object of your attention, and actually staying in the present moment. So meditation is the practice of mindfulness. So meditation being the practice for mindfulness, it's the training that we need to be mindful all day long. So to make this maybe a little bit simpler, you're going to sit down in your chair or on the floor or your bed or wherever you want to just be with yourself. Meditation is the practice of being with yourself, sitting with yourself. And you're just going to sit. You're going to sit in the most comfortable position possible without falling asleep. And you're going to allow your mind to think whatever it's thinking. You cannot stop the mind from thinking, and you can't stop what thoughts are going to come in your mind. You don't know what's going to enter into your mind. So you're just going to let the mind be. The mind thinks it's what it does, but your job is going to be to sit there, and let's say the breath is your object of focus, and just put your attention as best you can on your breath. The mind is going to think a thought, so instead of you engaging the thought, talking back to the thought might come in, oh, what am I going to eat for dinner tonight? Instead of you answering the thought in your mind, oh, well, you're going to go to Publix tomorrow. Instead of all of that, you just let all the thoughts be. Think of them as white clouds in the blue sky. The thoughts are coming in, and you're just going to let them pass right through the blue sky, because your focus and full attention is going to be on your breath. And you do that for a minute, 2 minutes, especially if you're first starting, just for a couple of minutes. The power comes from doing it, from you being the boss of you, and you're not going to get up and you're not going to engage the thoughts. You're just going to really sit there silently, gently, allowing the mind to do its thing while you do your thing, and that's focusing all of your attention on your breath. And I always like to say that you see the benefits of your sitting practice, of your meditation practice happen during your day when the mind starts running out of control, you know, traveling down that path of anxiety and worry and stress and regretting the past. And because you've been practicing every single morning for a couple of minutes, not engaging thought and bringing your mind back to the breath. So your mind starts worrying during the day and you think, wait a minute, let me come back to my breath. The training of, let me come back to the present moment. What's really happening right here? What do I need to do in this moment? Because between stimulus and response, there's always a space. So during the day when I'm stimulated by that stress or whatever is happening, and I'm starting to be anxious, wait a minute. I've learned in meditation to pause. I've learned not to engage the thoughts anymore, but to focus on my breath and be back in the present moment. And so every day I bring myself back to the present moment, back to my breath. I get a sense of security, of power. It really answers the question before. I don't need to know what's going to happen next because I know I've got everything that I need to handle whatever it is. So the stress of needing to know what's going to happen next just falls away for that moment. Now I may need to bring my mind back to the moment all day long. But as you will see, as you practice this day by day, you will see these are times of bringing my mind back to the moment that are very well spent. I'm actually rewiring my brain. I'm actually teaching myself that, wow, all the thoughts that I think, not only are they not true, over half of them are false and repetitive. And I don't need to listen to my thoughts because I have this inner knowing inside of me. If I just pause, come back to the present moment of what the next step I need to take for my own happiness, my success, for my family, for my community. So I know that was long. It is not as complicated as we all think it is in the beginning. I think instead of calling it meditation, it might be more helpful to call it sitting with myself. I'm just going to sit with myself for a few minutes. I hope that answered.
Yes, I love that too. Sitting with myself. That's a beautiful way to kind of explain a concept sometimes that you're right. I think it gets a little bit more complicated than what it actually is. So with that, I'd like to thank our speakers so much for spending this time with us today. I'm sure your schedules are incredibly busy, so we value your time and for sharing your insight on this a wonderful topic of head versus heart attack. And I just wanted to remind our audience, we do provide other sessions throughout the week, similar to the lifestyle practices that Dr. Johnson and Barb mentioned, meditation, exercise classes, and other webinars with information related to health and wellness. For more info, please visit events.baptisthealth.net and search virtual. With that, any closing remarks, Dr. Johnson or Barb, you'd like to leave our audience with before we sign off today?
I first of all want to thank Barb for this opportunity, allowing us to come together and really bring this East meets West focus as far as heart and head health. The other thing too is that really that benefit of meditation and sitting with myself and as people sit with themselves, it really benefits the heart beautifully, lowering blood pressure, helping the heart heal and strengthen the heart. And I continue to always highlight the benefit of peaceful mind, peaceful life. Barb, thank you so much for everything you've given to the community.
Oh, Dr. I just love you so much. We are so blessed to have you in this community. From the moment that I met you, I thought, oh my gosh, what a blessing in the community, and to be such a major part of the Boca Raton Regional Hospital. It's a joy to know you. I think the last thing I would like to leave is, for some reason, my mind is really thinking about sleep because I hear that the most, and I'm so happy that you brought sleep up. The one tip that I can give you, and it really fits really nicely with talking about meditation and mindfulness and the thoughts in the mind, is get a piece of paper before you go to sleep and write down all the thoughts that you're thinking, free write them on the paper. My daughter, Michelle, who you mentioned in the earlier, my partner here with Peace of Mind, Peace of Life, she always says our thoughts need a home. And so this is a brain dump. So if you're having trouble sleeping, write all of the thoughts you're having right before bed on this piece of paper. Give your thoughts a home, put the paper in a drawer, close the drawer, and go to sleep. The thoughts, it will amaze you as you start to practice how incredibly ruthless sometimes our thoughts can be. And I think they really interrupt our sleep. So it's been a joy. I love being with all of you. Dr. Johnson, thank you so much for your
Thank you, Barb. Thank you.
Your beauty in this community and your expertise. Thank you. And thank you, Baptist Health, for all that you do with these programming. It is truly second to none. Thank you.
Thank you so much.
Thank you,
have a beautiful day. Of course, have a beautiful day, everyone.
Thank you.
Thank you.